got it.
Hello. Hello. I'm Stacey and this is Anicia. We're St. Francis nursing students. We're just coming in to do your blood transfusion. It'll take up to 2 to 4 hours, and hopefully we'll get that hemoglobin that's low back up for you. First, we're just going to get some vital signs. Anicia's going to get your vital signs going for you. I'll get out of your way. Take your blood pressure. Blood pressure's good. Thank you. Check your pulse. Oh, pulse is good. Gonna do your temp. Temp is good. Under 101.7. Okay. We're just going to check we're going to use your IV site for the infusion. We're just going to check to make sure that it's all intact and everything, and it's in a good vein, which it looks like it is. Alright. Alright, and I got your blood. Got the blood for you. I can reach it. I'm short. Here, I got it. Just need to check it with your bands here. What's your number?
38FH66683.
Yeah. Can you tell me your name and your date of birth? Alright, that's good.
RH positive.
And your O pos, so that's a
O
good.
positive. Expiration's 11/10 of this year, which is good.
Alright.
Alright.
Now we're going to get your infusion started here. We got to use a Y tubing. So what we'll do is we'll prep it so that we'll have to change out the tubing on this normal saline that you're getting already and prep them into that normal procedure so they're all together. And then connect it to your IV site here. We're prepping it with an alcohol swab and connecting it in, making sure that it's patent, and hooking it all up.
We started slowly at 2 ml per minute, and then if there's no adverse effects, we'll increase the rate.
Also, you want to observe the patient closely and monitor and document their vital signs according to your facility's protocol throughout your transfusions to make sure that there isn't any adverse reactions occurring at any time during the transfusion. The main point is you want to, for the first 15 minutes of your transfusion, you want to make sure that you're staying with your patient because that's when most adverse effects will show, and then after that, you usually go 15 minute, and then about every hour until it's over. Your infusion needs to be done within 2 to 4 hours, including the 30 minutes that you have it out of the refrigerator.
If there is a acute transfusion reaction, we would stop the transfusion, remove blood and any blood-filled tubing, replace with the saline bag, and notify the blood bank and the provider immediately. Then we recheck tags and numbers and monitor vital signs and urine output, and we treat your symptoms.
Also, you always want to save the blood bag and the tubing and send them to the blood bank for examination. Never just discard the blood. You want to save the bag even if after you infuse it so that it can be treated as a biohazard. You don't want to just throw it away in the normal trash. You want to collect the required blood and urine specimens at intervals following your facility after the blood transfusion to make sure that everything worked out right, and document the infusion reaction on the patient's chart.
And the information we document in the chart would be the time of the transfusion, the people who started and ended the transfusion, the name of the individuals, verifying your ID bracelet, any unique product identification number on the blood bag, the product volume that's being infused, and immediate response for, like, there's no apparent reaction or there is a reaction, any type of how you're tolerating the transfusion.
So with transfusions, your main thing is that you want to make sure that the blood matches your patient by doing identification checks with more than one nurse by your facility's protocol, whether it's 2 or 3. You want to make sure that your blood is of the typing that your patient needs and that it's not contaminated. And you also want to stay with the patient for 15 minutes for that first initial transfusion to make sure that there isn't any adverse effects, and also check on them every 15 minutes just to make sure that there isn't any that go through that 2 to 4 hour window. And document any findings or any abnormalities right away and contact your physician. Thank you.